Well, it's great to see so many of you here, and to Jan Schakowsky and Doris Matsui, our leaders when it comes to seniors issues on the Seniors Task Force for the Democratic Caucus. Thank you every day for what you do. To our leader, Nancy Pelosi, who led the fight to make sure that we were able to not only extend health care to younger folks, working adults, but under the Affordable Care Act, today a senior can go and get preventative health care with no copay. Today, a senior doesn't have to worry so much about that donut hole when it comes to paying for prescription drug medicine. And so we have seen champions day in, day out on the Democratic side, and I'm very proud to stand here as someone who has watched the work of people like Jan Schakowsky, Doris Matsui, Nancy Pelosi, and all of my colleagues who are here today. But I think it's important for us to recognize something. A lot of Americans today still have a lot of anxiety. You know, will your kids, your grandkids be able to buy that first home, send their kids to college, and hopefully have the enjoyment of a secure retirement? Those are the kinds of questions that more and more we're all asking each other. Well, think back 50 years ago and ask that question. Anyone here who's a senior, if you're one of the 54 million Americans today who has Medicare, then think back 50 years ago when there was no Medicare. One of every two seniors in America lived in poverty back then and had no health insurance that they could afford. Today, because of Medicare, that 50% level of seniors without health insurance is down to 2%. 2%. 2%. And so we have anxiety today because we want to see all our fellow Americans get back to work and be able to afford that college tuition for their kids and know that we're going to be able to have a secure retirement. But we have to compare to where we are, and we cannot just take for granted that 54 million Americans receive Medicare and that millions more count on Medicaid to help them, whether it's their home health care or just to make sure they can buy those prescription drugs. And so it's up to us in these times when a lot of Americans feel insecure to tell them, you can be secure about one thing. There are members of Congress who will fight to the end to make sure we improve Medicare, not cut it, that we protect Medicaid, not cut it, and then at the end of the day, we're going to fight to make sure that whether you're a senior or starting your first year at work, the way my daughter, who just graduated from college, is beginning her first days of work. This is her first week of work in New York City, working with the district attorney's office in New York City as a paralegal after graduating from college. I want to make sure that just like you have that security of knowing you've got Medicare or Medicaid, that my daughter, should she ever find herself at the point of retirement, can say, I got my secure retirement, I have my Medicare, and there were the people in this room who made the fight to make sure that when she reaches her retirement age, she has her Medicare and her Medicaid available to her. Thank you for the fight you're making. It's just 50 years. Medicare's still very young. We got a lot of fighting to do to make sure it's around for all the next generations to come. And thanks to someone like John Dingell, who can tell us from plain experience what it means to fight for things like Medicare. Those are our champions. Thank you all very much.